Hello everybody, this is Mr. Lu. Today I am here for a health test, which actually don't think I need but she and Kate Lu keep cowboy. Why do I need to come here, B?
No, because recently Kate Lu's one of her best friend, right? Her father has a very serious heart attack, and the father is about our age or something like that. Okay, and then Kate Lu was very worried, and then plus the fact that Mr. Lu has been have a very hectic,
Young life.
very strong life. Okay, and then during this period of time we're in Singapore, so might as well do a proper health check. And then he hasn't have a health check for quite a while. Okay, so it's about time for him to do a health check.
I seriously think I don't need it because I'm very fit. I minus a bit of weight I put up recently because of yummy.
But it's always
food,
good to have a good health check, right? So that you can like tofu speed or things like that, right?
I got ginseng.
I know.
You know, superpower. I
you're
don't
very
see why I need
superpower
it.
and things like that. But the thing is that you need to ensure that everything else is working. Okay, don't overwork yourself. Okay, since we have time, might as well come and do a proper health check, right? Papa.
Do I look like I got health problem?
No, you don't look like, but no health checking, right?
Okay. Anyway, let's go. Yeah. This one I think it's I don't know whether I'm necessary or not. Yes, I haven't done it for a long time, but anyway, let's go and see. This one is a screenshot from for my appointment.
Thank you so much, sir.
Okay.
Let me just key in your ID.
Yes, Mr. Lu, be
Wow.
patient.
Not bad, This place looks like a hotel. This place is a hotel.
Oh, thank you so much.
Okay.
Sir, thank you so much. Thank you so
Yeah.
much, sir.
Thank you.
Thank you.
Thank you.
Okay, so I will escort you to the behind for the
Really?
class.
Okay. What I say? Okay. This is like hotel like that.
Yeah.
Where I go? I go there, is it? Okay. How much you pay for this?
Huh?
How much you pay for this, man?
Cannot
Yeah.
tell you.
Huh?
Cannot tell you how much.
Do I look like a kind of young person?
No, you are not.
But this place looks like a hotel like that.
This
I'm going
is
to
very,
see a
very nice.
hospital. So I'm supposed to see a doctor right now for a check, and the doctor is Dr. Brian. So, yeah. This is so nice that I feel like,
Hey, hello, excuse me.
hey, I walked until 4:30 yesterday night, Yeah, I think it's tough.
I think the doctor is here.
Hi, good morning.
Hi,
Hi, Dr.
Doctor.
Good
Good to
morning.
see you.
Good morning.
Okay.
Come in.
Yeah, thank you.
Hello.
Thank you.
Can I shoot a video of you?
Sure, no problem.
Yeah.
Hello.
Okay, I'm a YouTuber for
Nice to meet you.
okay, I'm a YouTuber for a finance channel.
Okay.
Yeah. So I thought share everybody what it means by a health check.
Oh,
Yeah.
okay.
I actually feel that I don't need a health check. I super fit. I know I'm 50 plus. I feel like 20 something years old.
You look like 27 as well.
No,
27.
18. Okay, but anyway, but tell me what I need to do.
Okay. So thanks for coming to Raffles today for your house screening. Is this your first time doing a house screening?
This is not, but it's about time.
It's about time.
Yes.
10 years ago when I was
No,
in
no.
Singtel, we have a corporate screening.
Okay.
Yeah. But occasionally I do a bit of health check like blood tests at a family doctor, and then there was another time pre-COVID I went for one what you call a treadmill run,
Treadmill, okay.
and then they put a lot of
Yeah.
stats on it and things like that. Other than that, I can't remember when I did a health check. Actually, I'm okay, but get my
But
family.
it has been getting more. The work has been getting more and more hectic.
I see.
Yeah. So
Yeah.
yes.
I mean, it's good that your family they're worried about your health, they're concerned, which is a good thing. So I just also want to ask, aside from the murmur, were there any other previous medical conditions that you had in the past?
I had a sinus infection in about 20 over years ago, and I had two operations. Two operations on it. Sorry?
What operations were you?
To enlarge the sinus airway, and that really helped in the breathing part because it was just a lot of pus and mucus.
Okay.
Yeah, but I took some TCM and that really helped as well. Yeah. So that's the only major operation.
And aside from these few conditions that you highlighted, are there anything else? Any other medical conditions like high blood pressure,
High cholesterol.
high cholesterol?
Yes.
Super high.
Super high.
That's not true.
I mean, high since he was like
That's not true.
the first time we checked, that is like 30 years old.
Then after that, my wife, managed to convince a family doctor to put some pressure on me and say that it can cause stroke, it can cause heart attack, and it can cause male function to degenerate and all something. And then I was on Crestor after that.
Crestor, okay.
Yeah, 5 mg. Okay.
So, I mean, it's quite hard with your job now, with the timings that you have to film and everything, long hours. So sometimes maybe it's quite difficult to find some time to get some exercise in.
But I do exercise a lot. I take 15,000 steps a day.
15,000, wow.
Yeah.
On the
Without fail.
Tracker lah.
Yeah, without fail.
I see. Wow, that's
Yeah.
very good.
But I walk late, 1, 2 a.m. kind of thing.
Then what time do you wake up?
About 10, 9.
Oh, so good
I've
enough.
adequate sleep. It's just the sleeping hours just move.
I see. Okay, that's good. And every day getting 15,000 steps
Without fail, yes.
without fail. Okay.
Without fail.
On top of the 15,000, do you go to the gym or exercise?
I do
or what?
some push-ups, about 30, 40 a day.
Okay.
Yeah.
And any family history of any medical problems?
Okay, my dad has prostate cancer. He's got high cholesterol as well. My dad's older brother has prostate cancer as well. My mom, obviously she doesn't have a prostate, but her brother died from prostate cancer.
Wait, your mom also got a bit of diabetic, right?
Yeah, my mom was diabetic as
Your
well.
grandma is diabetic.
That is true. Okay, and her brother as well. So there's some diabetic genes as well.
Okay, so mother has diabetes. Mom's mom has diabetes, right?
And mom's brother has diabetes as well. My mom's younger brother died from prostate cancer. So I got father side, mother side all got history of prostate cancer. And is it true? So my chances of getting prostate cancer is 100%.
Not really. For prostate cancer, whether you get it or not, it's quite a few factors that cause it, not just genetic. Evidence is sometimes mixed as to how you get prostate cancer. Many factors.
I see.
Yeah.
What is the most probable cause?
Most probable cause sometimes is due to increase in age actually. So as so the older for males, the older we get, the longer we get exposed to our sex hormone testosterone. So that causes the prostate to enlarge slightly. Aside from that, any other family history of any stroke, heart attack?
My father's elder brother had a stroke.
Father's elder brother.
Yeah.
Do you smoke or drink?
No, I don't smoke, I don't drink, I don't gamble, and don't womanize. No matter. Yeah. I got almost no vices except I eat a lot.
He likes food. He's a
super like
glutton.
food, and that's a problem.
All of us, we have a weakness for that, a soft spot.
Exactly. Yeah. Oh, there's sometimes because I work like 3-4 jobs, something like that, and sometimes at the end of the day I just feel like I'm like drained. But that's human, right? Drained, and I feel the heart is just like overworked, and I just feel like drained. Yeah. But other than that,
I mean, if I did 4 jobs as well,
that's true. Yeah.
I want to ask a little bit more about the aches and pains. Is it worse in the morning? Do you get morning stiffness?
No.
No? Okay, does the pain go anywhere else? To the lower leg? To the
If you
buttock?
have morning stiffness, what does it mean?
Sometimes morning stiffness can be associated with certain conditions like rheumatoid arthritis or because the back pain got many causes.
Sure.
Sometimes it could be a mechanical kind of pain or bone or muscle kind of
I
pain
see.
or other things like an inflammatory kind of pain.
I
That
see.
has different.
No, none of those.
Sure.
None of those things.
Okay.
Just normal old man aches, I suppose.
And it gets better with rest. Go through
Sure.
the health package. What we're going
Okay.
to do for you today.
Okay.
So this is what the itinerary is for today actually.
What beyond so many?
So long,
So this is the screen. It includes basically later we'll do a check for you.
Yeah,
We'll
today's
check
the worst time to do BMI.
your BMI, your blood pressure, and then later we'll do a chest X-ray, heart rhythm, ECG.
Alright. Okay.
And then we can choose one of the.
For prostate.
Oh,
Sorry.
Okay, man.
I tried already.
And so far, like when you urinate, is there any issues? Like, is it slower? Do you
Oh
feel-
yes, I go to toilet a lot, like urine a lot.
How often?
Oh,
But since the day I know you,
yeah. Since the
Since
day
it-
I go toilet very
I
frequently.
know him since 18 years old and he has been doing that.
How frequent is this? Like every hour you go?
Yeah,
And is there like a lot of urine that comes out?
yeah, reasonably.
Okay.
Yeah.
How
No, in the past he drinks a lot. He's I call it swiniu. Yeah.
How much water do you drink?
Last time he drinks a lot, but now he doesn't.
No, I do. I still drink.
Not that much.
Yeah, I still do drink quite a bit. Yeah.
More than 7 cups a day?
No.
Yes,
Huh?
I think so.
No?
Okay, around there, around there.
And a lot of caffeine?
No, no
coffee?
caffeine. No caffeine. Rarely
Rarely
tea.
tea.
I see.
Rarely tea. Also, but I do a lot of ayataka, those
Or green tea lah. Yeah.
green tea, that kind of thing. Yeah.
Okay. And when you urinate, do you feel like the stream is a bit slower?
Sometimes yes, sometimes no. It depends how much urine I have.
I see.
I go to toilet a lot in the night. At least maybe 2 times, sometimes even 3 times. Yeah.
Okay.
So, yeah. There are times that even 5 times.
I think it's a family history of father also, right?
Yeah, we still
5 times a
genetic.
night, that's quite a lot actually. Then your sleep there will be interrupted, right?
I usually urine before I go to sleep a lot.
Uh-huh.
Then during the night time, then I wake up 1 or 2 times. Never bother me with sleep. It means that after I urine, I go back and fall asleep. No
I
issue.
see.
Yeah.
Okay.
Okay, I have a bad habit. I like to drink a lot of water before I sleep.
Oh, okay. How much
Okay.
water do you drink?
1 cup, 2
cup.
cup.
2
Big cup.
big cups just
Yeah,
before you
big
sleep.
cup. Yeah. Because before I sleep, I take my Crestor.
Yeah.
And just
And a lot of
eat.
times he does his live stream before sleeping.
I see.
Late at night.
Yeah,
Yeah.
so I
he
talk
drink.
a lot.
He talk
So
a
I
lot and he
drink and
drink.
Very thirsty.
And after that,
So
before he sleeps,
there's
he'll drink
valid-
again.
There's valid reasons, yeah.
Okay. Well, a couple of things that I can suggest to try and bring down the frequency of the times that you
Drink
wake
less,
up. Not just drink less, but the drinks that you drink as well. So, for example, green tea, sometimes it has some element of caffeine inside. So I recommend maybe you can switch that to water. Definitely, if you do your live stream, sometimes your throat feels dry, you need to drink some water. But I recommend maybe instead of just drinking 2 cups before you sleep, you can spread it out over the duration of the entire night and just go in sips. So you consume less. And usually what I tell my patients is maybe 1-2 hours before they sleep, then you'll notice that you wake up lesser, more often. Yeah.
Okay.
Yeah.
Any things of concern?
No, so because what you're suggesting, what you have described just now, it shows what you call a lower urinary tract symptoms of suggestion that maybe the prostate may be enlarged already.
Yeah.
Because number one, frequent going to the toilet, sometimes the incomplete emptying, the dribbling. Sometimes some other patients they feel difficulty initiating the urine as well, so they have to wait for a while before the urine comes. So all of these are some symptoms. Not all patients with an enlarged prostate needs to be on medication or they need surgery or anything like that, but we need to monitor this. And sometimes with lifestyle changes, usually with fluid intake, you reduce it, it gets better. The
Okay,
symptoms.
so later when you check, you'll be able to see whether the prostate is enlarged.
So later when I check, I will be able to see.
Okay.
Yeah.
Okay.
Alright, so
That's a lot of checks.
Yeah, your right leg, right?
Yeah.
Can you keep it straight, keep it up?
Keep it straight, keep it up.
Yeah, don't let me push down now. I got to check your prostate. Is that okay? The prostate size?
I know. Okay, yeah.
Okay,
This
so
is the
maybe
one I'm
we-
most scared of.
We
I was-
some privacy lah, huh?
I scream.
Okay.
Oh man.
I'll
I hate
record.
this part.
I'll record your screaming.
You know, this is the part of ignore my rubbish, okay? Yeah, I really, nobody likes this part, right? I'm sure the doctor also hate this part. Okay.
Okay, so what you do?
The
Oh,
most important, how's my prostate?
Slightly enlarged.
Slightly enlarged, yeah. Am I in trouble?
Not really. Given that you have no symptoms.
I do have symptoms, I go to the toilet a lot.
Yeah, but calm down.
Okay, thank you. So done, eh?
Yeah.
To be frank, I think doctors are the most noble job. You know,
Thank you.
Yeah. It's the most noble job, you know. Yeah.
So,
But very fast. You did it very
yeah.
fast.
So coming back to the point, basically the examination was unremarkable. I couldn't really pick up a murmur that I
Okay.
heard. So far it's okay. Just on the prostate exam, it's slightly enlarged. So usually prostate size is about 2 finger breadths. Of course, different people with different size fingers, but usually it's about 2 fingers, like that. This is the average. That was about 2.5.
Okay.
Fortunately, I couldn't feel any nodules or any cysts, any lumps on the prostate. There was no pain to suggest inflammation or infection, so that's good. So I think what we can do is we can continue to observe to see how you are. We'll do the ultrasound as well
Okay.
to quantify, to make sure that to see how large it is or whether they can find any cysts or anything like that. Usually the mainstay of treatment for enlarged prostate, a lot of us we have that. But the mainstay of treatment is number one, lifestyle changes. So fluid, your fluid.
So it means drink a lot.
No, you can drink the same amount, but you have to spread it out at different times.
Oh, I see.
Just before you sleep, not really lah.
I see.
Yeah.
Okay.
But it may be hard in your case because especially if you are doing live streaming,
Yeah.
sometimes that may be difficult. So maybe you can suggest something to help work around that problem lah.
So it's not the amount of water, but it's the frequency of water.
And the duration when you drink the water, that's important.
So what's the suggested lifestyle change?
So my suggestion is, given that you do live streaming at night, I would suggest maybe you take the water consistently in sips throughout your live stream. If
What
that's
about
possible.
daytime?
Daytime as well. You can keep it the same, but usually maybe about 2 hours before you sleep, try to minimize the amount of
Oh,
water
so it is too much water at night that causes.
that cause you to go up, you wake up. and-
Yeah, but the enlarging of the prostate, is it linked to that?
No, that's not
Okay.
Yeah, the enlargement of the prostate can be due to many things. One
Oh,
of
I
them
see.
is family history. One of them is age related. Sometimes the only problem is when the symptoms impact your life. Then that's when we have to do something.
I see.
Like for example, you realize, wow, now I really have to wait for a long time before I urinate. Or every time when I go to the toilet, I'm the last one out. You know, when I go with my family, they have to wait for me. Or you know, I keep going to the toilet, but I always feel like there's still some urine inside, or there's blood when I urinate. Then those we may have to do further testing and workup lah. In some cases, when you have symptoms that really affect your quality of life, then the next step of maybe taking some medications would help maybe reduce the size of the prostate and keep it under control. And if that still doesn't work, then maybe the next step will be surgery to try to reduce the prostate. But of course, I'm not suggesting any of that. That's the
Ultimate.
trajectory of things. We try to continue to monitor it every year at the check, and then if there are any changes in your symptoms or how you feel, then sometimes we may recommend differently. What we can do is, since it's picked up early, at least we can continue to monitor it and then we observe it. And then what we'll do is we continue to do the rest of the health screening for you. The report will be out in about 3 to 5 days time.
Okay.
It will be sent to your email, and then you book an appointment to come back,
Sure.
and then we can go through the results again.
Wonderful. Okay. Wow. I never done such a comprehensive.
Super comprehensive.
Wow,
You're
it's
very
like-
detailed.
you are
Doctor, thank you very much.
It's
Really
all,
appreciate
as I say,
this.
it's all RMG doctor. All have to go through all this, right? But I really appreciate it.
No problem,
Okay,
no
really
problem.
appreciate it.
It's a
Okay.
pleasure.
Thank you.
Thank you, thank you.
Thanks for checking. Okay.
problem.
So what I do right now is I go for the series of tests,
Yes,
right?
yes. It's like a circuit.
Okay. Anyway, I've gone through the worst already,
Yeah.
so the rest is not so bad. Yeah.
Alright.
Thanks, Dr. Brian.
No problem.
Okay. So
Thank you,
you all
doctor.
come to RMG, look for Dr. Brian. Very good. All other doctors so good.
Yeah, we hold them to a certain standard.
Really?
Of course, yeah.
Then you're good RMG. Okay, but thanks, Dr. Brian.
No problem.
Thank you.
After
Thank you. Okay, thank you. So I just finished the consultation with the doctor. The doctor was super comprehensive, man. I never been through this kind of thing. Check every single risk factor I have. Even got my prostate checked and found that I got enlarged prostate, which is a point of concern. But you know, I think we all better do that right now. Now I'm gonna go through a series of tests, just waiting for the nurse to call me. Yes, yes.
Hi, sir. For blood test over here.
What am I supposed to do now?
Blood test.
Blood test.
Yeah, correct.
Ouch.
Draw
Draw
blood.
film this part. Okay, I'm. Yeah.
Yes.
Okay.
So okay.
Yeah. Yeah.
Okay. Thank you. I cannot film.
So I
Oh, you're
just
out.
got 5 vials of. I just got 5 vials of blood being collected.
Yeah, you got
But the
a lot of
kung
blood.
fu very good. Yeah, kung fu very good. Push in,
No
blood
pain?
come out.
Got pain?
Small little end bite kind of pain.
And bite.
Yeah,
Oh,
but
that,
my
that,
blood
that means she's very
gush
good.
out very fast. Yeah.
You got a lot of blood.
So, yeah.
Give me 1 minute. I come back to you shortly.
Okay, so I wait here, is it?
Yeah. Thank you.
You know, this this health check make me eye open. But I think better do. Okay. You never know what you can, right? 50 years old. Yeah.
This one is by far the most professional one.
I never seen this kind of professional check. It's
Yeah.
like coming to a hotel, very nice environment, nice doctor, nice nurse. Okay.
Well explained.
I
Patient.
just worry it costs a bomb, which B don't want to tell me how much. Like a
The hotel breakfast.
Where is the hotel breakfast, man? Doctor. Wow, steamed egg chawamushi. Wow. Okay.
You need to wait for
Okay,
refill.
what's this? Oh, not much food left, but they got cheese chong fan.
I think we are late, that's why.
Yeah, wake up late. Okay. Oh, I got free fruit. What is this? Wow, congee. See chop. Very good, man. Free fruit, bread. Wow, this is it's like first class treatment, man. It's like a hotel. Wonderful.
Number 1. And number 2.
Okay, so this one I do. Then after 48 hours later, I do this one.
Correct.
I drop off this within 24 hours, drop off this within 24 hours. Okay,
Correct.
over
Yeah,
here.
right.
Okay.
Then,
Thank you. Okay, yeah, that's easy. Okay,
okay.
okay. So where I do next?
Next would be the ultrasound and the X-ray.
Okay.
So my colleague will bring you over to the radiology department.
Okay.
So once you finish your ultrasound and X-ray, you are good for the day already.
Ultrasound and X-ray. Okay.
Correct. The ultrasound
Okay.
is the one that you need to test full bladder. Okay.
Full bladder now.
Full bladder. Not now lah. As in later when they bring you over for registration, then you start drinking water.
Okay.
Yeah.
All right, let's go. Full bladder, ultrasound. Okay, so my name has been called. Hello. Yes. Yes. Please. Chest X-ray, not the
Ultrasound?
not ultrasound. Right? Okay. Okay.
Bye.
I think I only take 1 minute. That's it.
Yeah,
It's
super
damn,
fast.
damn fast, man. Okay, 1 minute I'm done. Okay. This is the hotel.
Wow, so nice.
Wow,
Oh, look. Wow.
Look at this view, man.
Super nice. You done?
Done. So they did an ultrasound. So I drink a lot of water, then the whole bladder expanded, I suppose. Then they did an ultrasound. Press.
Very fast, huh?
Yeah, very fast. Yeah, press. Scan. I can see my prostate. I can see my bladder. I can
It's
see
what
everything.
kind of scan? What kind of scan is it?
It's an ultrasound.
Ultrasound?
Remember that time you
my leg, that one.
injure a leg, that kind of thing. Yeah, so you can see quite a bit of things like I don't know what the
Looks good.
everything is, but I think everything looks good now, and we are done for the day. So actually, it doesn't take a long time. Take about 1 hour plus. Actually, the most of the time is actually the consultation with doctor. Because
You
the doctor was
asked too
very
much
nice. Yeah, I
question.
know. I asked a lot of questions because I'll get my money's worth, right? So, but I think everybody should come here, man. It's a hotel-like environment. People are nice. Process is fast. They even got food. The treatment is good. You know, I just very keen to find out. B, are you gonna tell me how much it costs? So this is the moment of truth. B, are you gonna tell me how much it costs now that I finished the whole thing?
498 net.
498.
Yes, everything in. Good experience, right?
But the service here, top notch. Never
Yes.
in my whole executive life of Singtel that time, never had such wonderful experience.
Yeah. So this is actually they actually have this for like Father's Day and Mother's Day special. Okay. Then the other thing, what actually captured us, there's actually a tea set.
What tea set?
Like high tea set.
High tea set.
Yeah. So they I think after all this they're gonna email to us
You
for
get
us to
free-
collect. Yes. Somewhere
actually
in
can
Dhoby
eat-
Ghaut or something like that. I can't
can
remember.
eat one,
where.
ah?
Can eat one, yeah. Like high tea, you know. This
Oh
kind of high
really?
tea. Yes.
That's why you pick this one
Yes, in a way.
But
yes.
let's say fathers don't want high tea because I recently I pui 都是你害的。
Yeah,
Then you
no,
see,
it's actually-
she purposely can pick high tea set so I become more pui. Now you all believe it's caused by her, not caused by me. I'm actually not like that.
You wanna go for a movie?
I don't mind. I haven't gone for movie for years, man.
But they only have 4 kids. We got 3 kids. We need 5.
But they're not
sure?
free. Just the both of us go 2 times. I don't know what's the recent movie.
I don't
Wait,
know how it
okay,
works,
so wait. You can get free tickets
It's either
or
the
high
high
tea
tea
set.
set, okay,
Of course, get high tea set.
High tea set. I
Right?
think high tea set looks good. I look at it. It looks very very nice.
Okay.
Yeah.
Oh, not bad, So the experience is wonderful. You want the link? I go and find. You're supposed to download the app, to do it. Which kid do download, and the app is actually very good. And I was told that the app can even let you have what the nurse just said just now. Can let you have a doctor on call. That means you can do teleconsultation.
Oh,
24/7, and we need that, right? I can find the app and show you. But overall, I think this experience very good. Raffles Medical Group, I actually have
Impressive.
a different
Service very impressive.
It's like a hotel style or hospital. Yeah.
Yes.
So I don't reckon that's not the nurse passes the link or something like that. I'll try to cut the link and put somewhere. Okay.
Can.
You also need to check. You never do a checkup.
Can.
Women staff
Can.
What check the breast cancer, the kind of thing.
Yeah, I need,
all sorts of stuff and things like that.
Because,
Yeah.
the last time I checked, I think they say that there's a cyst or something like that. Yes.
You haven't checked again.
I told you before.
Okay, I go and register right now for you. So do regular health check. I think it's really very good for you. Okay, bye bye.